We're joining you from DH 2040 Summit in Bengaluru. We have with us today Director of NIMHANS, Dr. Prathima Murthy. Thank you, ma'am, for joining us.
Hi.
You made a very valid points during the summit that whatever capacity building has happened over the past 2 years, from March till to this date, can be used. The investment need not go waste. So can you elaborate on how this can be used for future waves and future pandemics?
Yeah, so one thing is that, touch wood, a pandemic comes once in 100 years. So hopefully we won't need it for another pandemic. I just wish we will never see another pandemic in our lives. But certainly there will be outbreaks of various kinds. So I think COVID has given us an opportunity to really develop our health infrastructure reasonably well. But I believe that if you don't use it, you'll lose it. And that's why I think it's very important. I think one of the biggest examples is philanthropy that has come in. Amazing to see so many people who have contributed equipment, beds, ventilators, oxygen apparatus, so many different things like that. And so I think if we use these well, we've also got this example from the COVID experience. If you have command centers, they have been extremely successful. So imagine if you had a command center with specialists sitting there, and then they would develop this kind of specialized care using the infrastructure that we've developed. One typical example I can give you is a hub and spoke model for acute stroke care. Now, I work at NIMHANS. We get a lot of poor people who come to NIMHANS. Very often they come because they have so much confidence in NIMHANS. Secondly, they've run out of money because care in the private sector at least can be very, very expensive for a lot of poor people. So I feel terrible when a person has to come from 300, 400 kilometers for acute stroke care or a head injury, which 70 to 80% of cases that come to NIMHANS can be handled like this. And our team is more than willing to help train people, train nurses, doctors, technicians to develop this infrastructure. So my dream is that in all parts of Bangalore, you don't have to travel very much to actually get this kind of care. And if you need more specialized care, certainly, that kind of networking with other hospitals can occur. So if we had a good network, just as we did during COVID, for any kind of acute care, it would be wonderful.
The national helpline, mental health helpline number at NIMHANS, it has given more than 6 lakh teleconsultations so far. And this is not just doctors from NIMHANS, but across the country. People there are no language barriers with respect to this helpline. So will these doctors continue to function in future, waves or pandemics?
Yeah. So I think what the psychosocial helpline actually told us is that on phone, you can respond to a lot of questions, queries, problems that people have. And interestingly, in different waves of the COVID, there were different kinds of callers. During the first wave 2 years ago, as you mentioned, it was mainly anxiety about COVID, how do you get COVID, etc., etc. The second wave was about where can I go to hospital, what do I do if my family member is not well, where can I get ICU care? What do I do if when my family member has died? How do I keep, get into touch with the relatives? Grief, And then there were occasional cases, as I said, of children's education as a concern. So different kinds of situations provoke different kinds of calls. I think the COVID helpline has shown us that it's possible to address this. And that's why it's now being expanded into the TeleMental health care, which is going to happen across the states and union territories. We don't have enough mental health professionals in the country. We don't have them equally distributed across the states. So imagine a model where actually every state develops its own infrastructure in terms of the counseling, in terms of having a center with mental health care specialists who will mentor these counseling centers, and networking with anybody, private physicians, hospitals, institutions, Ayush, for holistic care. I think the opportunities are tremendous. So I think it's how we use these opportunities now that will determine how well we can improve healthcare infrastructure.
You mentioned the National TeleMental Health Program, of which 23 centers of excellence are a part. So it is not just NIMHANS, it won't be spread thin with its capacities and with its abilities. So can you tell me how far that has come?
So we've had a post-budget webinar where actually there's been a lot of brainstorming, because again this has to develop organically, and this is possibly the first in the world that will at such a scale be able to address this. So we're getting in experts not just in mental health care services, technology experts, public health experts, system experts. We're having a huge number of stakeholder meetings, and then arriving at a proper reference document for it, a training manual, a proper directory of services in each state and union territory, and then of course onboarding all the states and UTs, all the centers of excellence, and trying to get everyone together to develop a national service.
Thank you so much for joining us, Dr. Murthy. Tune into Deccan Herald website for more exclusive interviews from the DH 2040 Summit all day today.